Alright, so this is a transgender patient. She had previous body fem by another surgeon. I did a revision, and now we're back 5 months after my revision to do a little touch-up. Additionally, we're going to be doing rib remodeling. All that means is that we're going to fracture the 12th, 11th, and 10th rib. When we fracture the bone, it creates an angulation or a bent or a dent in the bone. And then afterwards, the patient's going to be in a corset to really bring in the waistline even further than you would from just liposuction alone. We're going to expand the thighs, improve the shape, bring in the waist by both liposuction and bony remodeling.
24/7 on my mind, day and night, all the time. You ain't even by my side, yeah. 24/7 fascinated, you got me infatuated. Feel the power in your eyes. Must be voodoo you're doing, it's pulling me back. Does a sip of your potion and my body reacts? Feel the chemicals moving, it's a matter of fact. Every time that you touch me, my body.
Alright, so this patient had previous body feminization before me, and then I did a revision. We made a lot of progress, and now I'm basically doing a round 2 little touch-up work. We're going to expand the base to create more of a heart shape, bring this down, which is the midpoint. Currently, if you look at her photos and analyze it, there's too much projection at the halfway point of the buttock. So we're going to decrease this as the point of most projection. We're going to increase the base, which is more aligned with a heart shape, and then we're going to fill in a little bit of a gap here. So this is more of a refinement than a round 2.
On my mind, day and night, all the time. Like my body's hypnotized, yeah. 24/7 dominated by the spell that you created. You take me to paradise. There's something about you, love and magic. Makes me come alive, makes me come alive. Head on fire, red hot flashes, brings me back to life.
Improvement in the silhouette shape. We took down this area that was over projected. There was too much fat placed in here previously. This is before my time, so too much was placed here. It was shaped down. We built up the base, which is more in line with a heart shape. We also improved the upper pole, and we also filled in the upper hip dip area here that was a little bit deficient. Waist, of course, is thinner. Before doing any rib procedure, we always get a CT scan. So this is a CT scan with 3D reconstructions. Count how many ribs there are. There's 12 ribs. One of our patients had 11. Then we measure out kind of where the angulation starts to really bend on the rib. So somewhere around here is the angulation, and we measure it out. It's about 8 to 10 centimeters. So this is around 8, this is around 10. And this is something, so when you break the bone, it's a monocortical fracture, meaning just the upper part's broken, but the part on the bottom is still intact. So it creates an angulation. When you heal, if you don't wear the garment, it's going to go back to this, right, straight. What you want to do is heal while the bone is angulated. That angulation is what allows, the angulation right here to bring in is what allows the waistline to narrow. That angulation is maintained by wearing the corset. This was shown to me by a friend of mine, Dr. Andre Marshall, so thank you for showing me that.
Gasoline, so burn for me. Oh yeah. Must be voodoo you're doing, it's pulling me back. Does a sip of your potion and my body reacts? Feel the chemicals moving, it's a matter of fact. Every time that you touch me, my body reacts. My body reacts. My body reacts.
1-week follow-up, transgender patient. We did both a revision lipo with fat transfer as well as rib remodeling. I'm going to focus mostly on the rib and some nuances of the revision. Let's go. Most important, I want to show, this is a closed approach, so we just use an 18 gauge needle. These wounds are going to heal perfectly. So you see those little dots right there? That's all we had to do the ribs. You could see that based on her before photo, the ribs create a very powerful effect in the waistline. Additionally, in regards to her revision, she wanted more of a heart shape. So I had to basically undo the other surgeon's work. The other surgeon had too much volume up here and not enough down here. And when you think of buttock aesthetics, you want the widest point to be the base, which is down here. So we reversed the relationship, made it more of an hourglass. She's super, super, super stoked and happy. And again, complicated surgery, round 2, revision, rib remodeling, but she's doing super. Rib remodeling, revision BBL, complicated surgery, transgender patient. So we had to reverse our relationship. I had to bring in the waist and really improve the waist to hip ratio. We're gonna show you some 3D imaging in a minute. So waist comes in really dramatically with the rib remodeling. I had to really change her shape. Her previous surgeon added too much volume up here, no good. Shaved it down, built up the base, and really created a nice hourglass shape. So the final step is the corset. Super, super important with ribs. Well, the whole mechanism of how this stuff works is we create a monocortical fracture, which means there's a fracture in the outer table, the upper part of the rib. It fractures in. So it's not a full thickness fracture, it's just upper table. Once it fractures, we create angles, it creates an angle. Then we corset the patient for 4 months. So nice thing is that this procedure is super powerful, great results. Downside is that it definitely takes work on the patient side because they have to be very compliant. Thanks so much for watching. If you enjoy the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.